Good day, guys. I'm Eric Alapisco, and I'm going to be talking about COVID-19 should not be mandatory for healthcare workers or social workers. Um, I'm going to start going with the introduction, paragraphs, and the reasons why this should not be mandatory. I'm going to give you an alternate perspective of why this should be mandatory, and the conclusion. Also, some of the articles that I added to peer-reviewed will be Roger Daniels and Blackshot Bruce that wrote COVID-19 vaccination should not be mandatory for health and social care workers. LongIndia.com, should COVID-19 vaccinations be mandatory? Abel Jason T, why a universal COVID-19 vaccine mandate is ethical today. And Lubel Jennifer on why COVID-19 vaccinations should be required for health professionals. All right. Back in December 2020, nobody expected SARS-CoV-2 to become a pandemic and a big problem for everyone. It affected everyone in many ways, financially, mentally, and socially, but thankfully on August 23rd, 2021, the Pfizer vaccine was approved by the FDA and started rolling out for people ages 16 and older. The vaccines were first sent over to healthcare workers like me so that they could be safe from infected patients and protect the patients as well. The vaccine then became mandatory for healthcare workers, and those refusing to take it, they will be redeployed or have their employment terminated. In this essay, I will explain why the COVID-19 vaccines should not be mandatory for healthcare workers. Although the COVID-19 vaccines are saving lives and reducing the risk of infections, mandating the vaccines to be taken or be terminated ignores the workers' concerns about its effectiveness, causes psychological reactance, and may have an effect on healthcare recruitment or employment. By threatening employees to take the vaccines or else get fired, clinics and companies show how little they care about their employees' concerns and care more about the money. Attempting to override their concerns with a threat of the reemployment and job loss shows insufficient regard for the moral integrity or their bodily autonomy. That's a quote that Roger Daniels adds on his article, COVID-19 vaccination should not be mandatory, on paragraph 7. Now, to continue, making vaccines requirements for employment could cause employees to become distrustful or even be against them, against taking them, also causing clinics and hospitals to have a hard time to recruit new healthcare workers. Many employees already try to avoid taking shots, for example, the flu shot, even though it is required to take it when working with patients. A lot of them don't take it because it's not as an obligation like the COVID-19 one. A lot of healthcare workers have not gotten sick without the need of vaccines, so they keep on believing it's necessary to receive them. So forcing them to take them will have them continue reinforce their beliefs. A quote from Rogers in the same article, paragraph 8, says the vaccine mandate risks eliciting psychological reactance, exhibition of anger, and negative conditions by individuals in response to a lot of freedom or limited alternatives. Among frontline workers, this could reinforce and even increase vaccine hesitancy towards COVID-19 vaccinations, as well as other unrelated vaccines, like the flu shot. One good example on how this will make recruiting more people for healthcare harder is when Rogers explained how there's already a huge shortage of healthcare staff in England, stopping new admissions in care homes due to staff shortages. There's already an acute shortage of nurses with almost 39,000 vacancies in England and on average 105,000 adult social care vacancies per day. Up to 50,000 care home staff may be unable to work because of the vaccine mandate. Roger 11th. Now, to looking at it from a different perspective, COVID-19 vaccinations could help people who are not able to get vaccinated due to medical reasons, and it could also help society speed up the process to become immune to this virus. In the commentary, should COVID-19 vaccinations be mandatory, by LongIndia.com, the article explains how there's growing evidence of the vaccines reducing infections. The quote says, there's no effective cure currently available for COVID-19. However, recent reports indicate that a single dose of either the Oxford AstraZeneca or the Pfizer-BioNTech vaccine can provide high level of protection against COVID-19 symptoms, serious illness, and avoid the need of hospitalization by 80%, including reduction in mortality from disease. Longdini, paragraph 2. In another article called Why Universal COVID-19 Mandate is Ethical Today, it talks about how one's decisions can harm another person. If one does not take the vaccine simply because they do not trust in it or believe in it being effective, it can cause others to get infected, land in the hospital, or even cause their deaths. The quote says, when one person's choice might harm another's, it can be ethical for that choice to be limited. That's why we have speed limits and stop signs. Both limit your the right to drive as you might wish, but they're necessary for public safety. If you choose to drive recklessly and put others at risk, you should expect a fine, possibly lose your license to drive, or even go to jail. Other examples include laws about smoking in airplanes, firing a gun in an urban area, or starting fire in a crowded theater and causing panic. Rule J, paragraph 4. Not mandating the COVID-19 vaccines outweighs the argument of why vaccines should not be a requirement for employment. People will always and should always have the right to deny any sort of vaccines despite the information being given to them without having any punishment or consequences. Unfortunately, a lot of people who do not take the vaccination and depend on people getting vaccinated will not have the kind of protection guaranteed. At the end of the day, forcing people to take the vaccine or expect to get fired is unethical, and the law does not allow it. Lastly, in conclusion, there are many reasons as to why the COVID-19 vaccines should not be a requirement or mandated for employment. People will think twice about applying to healthcare jobs by not trusting clinics and hospitals, and if they're hesitant to take it at first, people will definitely not take it at all. Just as there's many reasons as to why they should not, there are also important points as to why people should take the vaccines. We could help those who cannot take it due to health factors and help society advance faster, living this period of pandemic and helping the economy go back to the way it was. These two sides of the argument will have many pros and cons, which will continue to be a debatable subject in society today. Thank you.